Is my audio okay?
The audio is clear.
Okay. So if you want to make money, then you must focus on geriatrics practice in future. And if you really care for humans, you must focus on old age people. And Parkinsonism is all about that, because yes, the cases increase when you grow old. Parkinsonism and Alzheimer's is the new a big giant which we look forward to, as there are advances in the therapies and people are going to live longer. There are a couple of slides which we will go fast so that we understand how we are handling it. So if we understand this is the introduction, Parkinson's disease is a progressive nervous disorder. It affects movements. Now, while I'm talking to you, I'm making some kind of facial gestures and my hands are moving. This all thing disappears. The person has a masked faces and they will have only tremors. While talking, if you can see my hands, they will have the noticeable tremors, and other than that, they will have a masked faces. This is what it is given. Masked facial expression. They will not be able to give any smile. Stooped posture. Rigidity. The whole body will be rigid. Forward tilt of the trunk. And they're always scared that they will fall and they'll be trembling in the whole body. So this is...
sorry to interrupt, your slides are not moving.
Okay.
You can see the first slide only, medical approaches to treat.
Okay, how do we do that? Because they're moving for me.
You have to select the screen of the slide which you can see. Maybe you can stop sharing and then again just share those screen which is moving slide.
Stop sharing.
And then share the screen which has the PPT slideshow format.
Does this come? Is this changing?
Yes, sir. Good to go. Good to go.
Okay.
Yes, sir.
Now, so this is what we are, first and foremost, we talked about. The topic is medical approaches. Introduction is a disease where there are trembling, there is hypokinesia, as well as there is, masked faces. We have just shown this picture. Facial expressions are nil, and then they stoop forward. And these all things happen when you grow old. Etiology, we do not know. But yes, family history is there. So having one or more close relatives, your chances go up. If you're above 60 years of age, or if you're a male, then diseases are very rare. Majority of the diseases are more in women. It needs to be understood, like autoimmune disease, like thyroid. But this is a few disease like Parkinsonism, which is more in males. And low estrogen levels is very, could be something which is the reason behind it. Medications which can cause Parkinsonism is rizapine, lithium, and metoclopramide, methyl dopa, haloperidol, chlorpromazine. Few of these drugs are given in psychiatric medication. Head injury, for any reason, especially boxers, they get these diseases very commonly in old age. So you need to save yourself. And BSJN is not good. Is to be understood. BSJN is BV se jhagda nahi. Otherwise, repetitively head injury will cause you the Parkinsonism. So BSJN to be understood. Pathophysiology is, this is what it is, degeneration of the dopamine producing neurons. So there is less of dopamine and impaired extrapyramidal tract and loss of motor control. Now, these three things we need to understand. We usually call it as a RAT. Rigidity, that means there will be stiffness of the body. Akinesia, that means they will be moving less. Overall, they will be moving less. And tremors. So, chalna nahi hai, and chalne mein bhi resistance hoga, but you will be shaking regularly. That's what is the whole thing which happens. This is what the pathophysiology behind it. I don't think I'll go through this. These are the clinical manifestation which you need to understand. Rigidity, increased resistance. So, हाथ को मोड़ना बहुत कठिन होगा. Though they will be shivering, but you cannot extend it or do it. Cogwheel rigidity, tremors. This is what pill rolling tremors, as if they'll be always have got something like they'll keep moving their fingers just like this, if you can see. So this is what we call it. Akinesia, absence of movement. they will not be starting any moment. So अगर वो बैठे हैं तो बैठे रहेंगे, लेटे हैं तो लेटे रहेंगे, and postural instability, the chances of falling is very, very high. Old people otherwise have osteoporosis, and when they have Parkinsonism, October 20th, I believe, is World Osteoporosis Day. We have to understand that once you grow old, your whole body grows old, and it's duty. I'm very, very happy that Khushbu and Garima has planned this thing of today's Parkinsonism, because yes, it is a multidisciplinary approach. A lot of patients believe, a lot of family members believe, doctor ko dikha de hamara kaam khatam hai. Absolutely wrong. Doctor ko dikha de, that is the beginning of the treatment, and you need to have a regular communication with regarding the treatment with others. I'll go very fast. Yes, symptoms of Parkinsonism. This is important, which you need to understand is first and foremost, hypo anemia, drooling of saliva, low one. आप बहुत छोटा छोटा बोलते हो. You do not speak it louder. Your voice will not be clear. Dysarthria. You do not speak well. Problem with swallowing. So that's what even I think few days back we had discussion about Stan Swami, and he was not given the straw. So stiff face in advanced PD, that is Parkinsonism disease. There is dementia. आप भूल जाओगे. You will forget what you were asking. So old age comes with a lot of diseases, a lot of issues, and we need to understand. Definitely there is a diminishing cognitive function. As the slide shows, there is a brain involved, depression and anxiety. There is a lung involved. There is upper airway obstruction. There is muscle weakness, and then there is a constipation. इसीलिए nursing care and physiotherapy is much important along with medicine, so that like for constipation, giving a Dulcolex is the easiest answer doctor can do, but making sure that patient does move around so that there is a normal movement of food in the body. This is what you need to understand. Complications, these include motor symptoms, dyskinesia, dementia, depression, hallucination, dysphagia, painful or inability to swallow, malnutrition, aspiration pneumonia, orthostatic hypotension, and risk for fall. एक बार गिरे तो फिर कभी भी उठना कठिन हो जाता है. Once a person falls and has a fracture, take my words, the life ends in 6 months to 2 years. The study has been done and we have found it out. So preventing a fall is a very important thing which we all need to know. Before starting treatment, we all need to know the person's individual clinical circumstances. We have to understand comorbidities. We have to understand person's individual lifestyle circumstances. We have to understand. So there are a lot of things which are involved. That's why a good nursing care and somebody who can give good home care is important. What we are trying to achieve: early recognition of changes, improved quality of life, improved long-term management, improved patient understanding. Patient ko doctor banana is very important. Minimal side effects, realistic outcomes. Considerations: current evidence advocates early treatment, which needs to be understood. Effect upon employment, because obviously you lose your job, obviously you will not be a blood provider. Or subtypes of Parkinson's we will discuss. Clinical lifestyle preferences, patient preference, age, and the length of the management time. Management is often complex. Warning: challenges ahead, we all have to understand. Amit sir, there is no reversal of this disease. You cannot have a person becoming young. So there are a lot of challenges ahead. Diagnosis is based on the clinical feature. Primarily, clinically we diagnose Parkinsonism. CT scan, neuroimaging is done only to rule out TB or cancer. PET scan to evaluate levodopa uptake and conversion to dopamine in the corpus striatum. Now, this is what you can understand it is examples of the various questions that people with Parkinson's disease might have during the consecutive phases of disease. Prodrome period, diagnosis. These are the various questions they'll have it. When does Parkinsonism disease start? Will I become symptomatic? When can I do? What can I do to prevent that from happening? So Parkinsonism is not only about giving the tablet, it's a lot more. This is one slide which I want all of you to understand. Ability to participate in self-management is most important thing. You have to understand multidisciplinary care is important thing. Informed and engaged patients and the caregivers. Device-aided therapies and conventional pharmacotherapy. Doctor has to primarily do this small part, conventional pharmacotherapy. There are other three pillars which are need to be addressed. Levodopa is what we give, and this has an issue because it's kind of half-life is very less, so it should be given 3 to 4 times or 5 times a day. Duodopa directly to jejunum, where levodopa exclusively is absorbed. Wearing off and on fluctuations, typical patterns of how levodopa medications wears off during the day. This is what needs to be understood. Here we have taken the medicine, if you can understand, and then patients' symptoms are alleviated, and then they come back again. So we need to give more frequently, 4 to 5 times a day. Factors underlying appearance of motor complications, pharmacokinetics, delayed gastric emptying, they have a constipation. So even if you're giving tablet, is it getting absorbed is what we need to understand. Short half-life, I've already talked to you about it. Pharmacodynamic is loss of presynaptic buffering is another things because it gets degenerates there. Dopamine agonists, these are the ones which we give it, pramipexole, propinerol, protigotin, and apomorphine. Consideration with dopamine agonistics are counseling, pre-morbid personality, age, sex, are they living alone is important to understand, or documentation, oral transdermal patch, and dopamine withdrawal symptom. Use of this patch, we will not go into it. There needs to understand it does help, but having the consistency with the treatment is more important. MAO-B inhibitors, selegiline, rasaglin, as well as safinamide, they block MAO-B to preserve the natural occurring dopamine. Quite often we use it, and these are used even as antidepressive agents also. COMT inhibitors, that is catechol methyltransferase inhibitors, inhibit the peripheral metabolism of levodopa. So along with levodopa, if you are giving this, you will have prolonging the levodopa half-life and making the more dopamine available, levodopa available for transport across the blood-brain barrier. So you have to, usually the brand which we give is Syndopa, you need to understand, and that has got both of it together. It inhibits in liver and GI tract, allows for enhancing medication without increasing levodopa. This is what entacapone and opicapone is what we give it in our regular OPD. How does this drug work? There's a huge thing, I think probably not relevant for our session, but yes, taking the medicine regularly is most important than anything else. This is the same thing which we are discussing it out. Anticholinergics help to quite a lot of extent, but then they have got their own side effects. They worsen the, constipation and other things. Dopamine therapy for motor symptoms in early Parkinsonism disease, practice guideline summaries are given out here. Therapy for the motor symptoms is clinician should screen patient for cognitive impairment, sudden onset sleep, hallucinations. So there are a lot of it. How do we go about it? Is advanced therapy, I would want to tell you, deep brain stimulation is available. Apomorphine subcutaneous dopamine agonist is given. Duodopa is intestinal gel, which can be considered. Apomorphine subcutaneous infusion in patients with Parkinson's disease with persistent motor fluctuations is, there has been trial which has been done, and they have found there is clinical meaningful reduction in off time in the patients with Parkinsonism disease. Surgery, quite a lot of people, even for the continuous epilepsy also, there are a lot of surgeries which help. Like that, neurosurgery is optional when medicine doesn't make the symptoms better. Thalatomy is a surgical procedure and when opening is made into the thalamus to improve the overall brain function. Deep brain stimulation is pulse generator high frequency electric impulses to the thalamus and block the nerve pathway to control tremors. Deep brain stimulation, if you can see, this is the simulator which has been given and stimulating the thalamus. Physiotherapy, take my words, you ask me, I will believe that this is one of the most important part of the management. Exercise training, strength training, balance training, correcting eating impairments, verbal skills. Home-based exercise programs have to be considered. And this is what is in a diverse group of older adults at high risk for falls. Treadmill training plus VR led to reduce fall rates compared with treadmill training alone. So this needs to be understood depending in terms of how the gait is, and we need to be doing it in along with others and understanding it. Nursing management, because they will have issues with respect to the passing stools. They will not have a clarity of the speech, and they will have to be assessed for the sign of depression, assess family supports. Nursing assessment has to be in terms of general, integumentary, cardiovascular, GI, neurological. We have to understand these various parts and see what all needs to be addressed. Nursing diagnosis is these all things which we see: impaired physical mobility has to be worked upon, imbalanced nutrition like vitamin D and B12 need to be worked upon, impaired verbal communication, you'll have to start understanding. आंखों को पढ़ना सिखाना पड़ेगा, because yes, when the people grow old, they get very irritated and they may not be able to communicate well. Constipation related to diminished motor function and activity, and risk for fall related injury and impaired sleep patterns. Therapies which are under investigations are these many. I wouldn't go deeper into it. Mitochondrial dysfunction, Parkinson pathway, and neurotropic factors. Before I finish with the word of thank you, I would want to tell you one thing is, what kills a patient more? October is, 1st October is the International Day for the older people. A sense of being uncared, unloved, and unwanted, where people start believing कि जीना जरूरी है क्या? Can we poison ourselves? Old people committing suicide is becoming very, very common. And yes, anybody who can do our job of calling up somebody, hugging them and telling them, auntie, how are you? साहब, दूसरों के कांटों से ज्यादा अपनों के फेंके हुए फूल ज्यादा दर्द करते हैं. So the people, the caregivers, they also require, when they speak a slightly high tone, people get hurt very much. We need to understand in all these things, medical treatment, physiotherapy treatment, we need to understand they require a mental health treatment. Coming 10th of October is World Mental Health Day, and mental health of elderlies is much, much more needed than anybody else. With these few words, I would congratulate Dr. Khushbu and Dr. Garima for having organized this. Any question, I'm fine to take it right now, or probably after all the 3 sessions are over. That would be a great idea. Thank you.
Thank you so much, sir. Thank you for wonderful insight about the medical aspects, and very rightly said that patient-caregiver relationship is very important and how we have to go forward with it. Thank you so much, sir. Any questions for now? Okay, so we'll take up the questions in the end. So we request our next presenter, Dr. Khushbu Gadda, BPT Nair Hospital, MPT Physiotherapy, KM Hospital, founded at Fit Fully Yours Physiotherapy Clinic, Wadala West, Mumbai. 5.5 years of experience in seeing cases with movement disorder, Parkinson, stroke, paralysis, and children with cerebral palsy. The stage is all yours, Dr. Khushbu. Please take it forward.
Thank you, Dr. Rima, for the lovely introduction, and thank you, Dr. Ashish, for your very informative session. Very rightly said that after so many years of seeing patients with Parkinson's disease, I think the main thing that really affects the individuals is the personal relationships that they have with their family, and how see their own disease. That really impacts how their progression is going to be like, and how their recovery and way forward is going to be like. So what I am going to cover, I think Dr. Ashish has done a wonderful job of covering the medical part and what exactly goes wrong with Parkinson's. So a few terms that we learned today are, first of all, movement, dopamine, Parkinson's, visual and cognitive therapy, tremors, fatigue, and freezing episodes. So let's start with the first and foremost thing, which is dopamine. So how is dopamine produced? It is a neurotransmitter in the brain, which is secreted all the time inside the brain, and it does multiple functions In the functional perspective, dopamine is definitely more used for motivation. So आज अगर आपको सुबह उठ के मोटिवेशन आ रहा है कि मैं ये वेबिनार अटेंड करूंगी, that is dopamine working. That dopamine is giving you that motivation to go and attend the talk because it will be really helpful for you. How dopamine becomes less in Parkinson's, they still don't know. They are still finding out what are the different pathways which are affected in Parkinson's. They have been successful in finding one or two pathways, but still a lot of research is going on. But how dopamine is abused throughout our life, सबसे पहले तो अगर कोई addictions हुए हैं, alcohol, cigarette smoking or any other narcotic addictions, then it does cause the dopamine to reduce and it does cause movement disorder and Parkinson's to occur. Other ways that nowadays we are seeing is the surge of technology and mobile use. So that is also one thing which really affects the dopamine production. Other natural rewards through which the natural dopamine is produced is by the way of having community relationships, having a community, a sense of belongingness inside a community. Have like they have given an example, a photo of mother and the baby, the mother holding the baby. So when she is holding the baby, she is getting that natural boost of dopamine that she is having. Another natural reward which we get through dopamine is food. So when we eat a particular kind of food, dopamine is again produced by that. Why this is important? Because we will be using this natural dopamine reward system in our therapy in the future. So one very important relation that they have found is of the gut-brain axis. So our gut, which is our which includes right from our mouth till the anus, the whole gut system is directly connected with our brain. So whatever we are putting inside our mouth is directly affecting our brain. So जो भी आप अगर आपने आज सुबह ब्रेकफास्ट में हाई शुगरी हाई कैलोरिक कोई फूड खाया है, तो वो ऑटोमेटिकली आपके ब्रेन को एक शुगर रश देगा, आपका ब्रेन ओवर टाइम में चलेगा. But at the same time, if you have eaten something very healthy and very nutritious, it will really help to supplement your brain health and it will really help to prevent any further neurodegeneration from happening. So, who are at risk of developing Parkinson's? Mostly, it comes after 60 to 65 years of age, but nowadays they are finding Parkinson's even in the younger age group, young onset Parkinson's. They say that men are more affected than females because females have this natural neuroprotection mechanism with the way of estrogen. Genetic history, yes, it's very important. I once knew one family जिसमें mom and the sister had Parkinson's, and now the females, three daughters also had started developing Parkinson's a decade earlier. So genetic history is also there for Parkinson's. Exposure to toxins. So once I had a patient working in a chemical factory also. So there they were producing plastic materials, and he ended up with Parkinson's symptoms. If you've had a previous head injury or a stroke, then you are more likely, more risk at developing Parkinson's in the future. And other side effects are drug induced. If you are on some psychiatric medicine, some mental health disorder medicines, then it can be drug induced as well. Is the prevalence of Parkinson's increasing? So आजकल ये question आ रहा है कि Parkinson's इतने लोगों में क्यों पाया जा रहा है? Like why out of 10 people, 20 people we know, we are seeing at least one or two cases of Parkinson's developing. So in general, they are saying that average lifespan has increased. So nowadays, people are living beyond the age of 60. They are living up to 80, 90 as well. Earlier what used to happen was कि bacterial infection, viral infection जिसका कोई medicine नहीं था, they had not yet developed antibiotics. So individuals used to expire by the age of 40 or 50. But nowadays the average lifespan has actually increased because of so many medical facilities being available. So more and more people are living beyond the age of 60, which obviously if you see probability wise, then it causes the high chances and high probability and risk of developing Parkinson's. Second thing is, more than bacterial and microbial infections, we have more of lifestyle diseases which are prevalent, like blood pressure, diabetes, high cholesterol, which are more common now. In general, a stressful life and increased screen time, individuals are more aware of their health and seek help. So, they say that Parkinson's, if anybody had, then it as an aging related issue. So they used to feel that हाँ उम्र हो रही है तो शायद इसकी वजह से मुझे tremors आ रहे हैं, शायद उसकी वजह से मैं slow हो गया हूँ. But nowadays they are going to the doctor and trying to understand what is going wrong. So maybe because of that also the diagnosis is increasing. And yeah, use of technology I would really emphasize, because कोई भी एज ग्रुप ले लो, अभी मेरे 57-year-old मॉम एंड डैड भी है कि मोबाइल पे ही बैठे रहते हैं. सो यू नो टेक्नोलॉजी हैज लाइक रियली कॉज्ड एन इशू. एंड थोड़ी देर के लिए सोशल मीडिया स्क्रॉल किया, 1 मिनट से भी काम नहीं हुआ, बोर हो गए, दूसरे ऐप पे चले गए, तीसरे ऐप पे चले गए. सो मोबाइल्स हैव मेड इट सो इजी फॉर अस टू cause less attention and less and more boredom in general. In India, they have not yet found a very good data, but they are seeing that certain ethnicity is more prevalent of Parkinson's, particularly Parsis living in Mumbai, Western India, have more chances of developing Parkinson's. So, what are the different stages? Like pictorially, you see that there are different stages. Usually, the diagnosis होता है कि they are between stage 1 and stage 2. इसके पहले पता नहीं चलता है. So, progressing from stage 1 to stage 5. But again, it's not necessary कि आप progress करोगे. ऐसा भी हो सकता है कि आप stage 2 पे ही रुक जाते हो. ऐसा भी हो सकता है कि आप stage 1 to stage 5 rapidly जा सकते हो. So again, it really depends on individual factors. आप कितना physically active रहते हो, कितना आपने आपके doctors का advice follow किया है. So that is very important when it comes to progressing through these stages. So just because आपका diagnosis Parkinson's हुआ है does not mean that it's a death sentence. You can definitely stop it at a certain stage, or you can delay the progression as much as you want if you are aware of your own self. So as I said, it's not illness, but it definitely worsens, and the rate is variable. Like in some cases, the rate will be very fast, but in some cases, it might not be very fast. So as soon as आपको कुछ लगता है कि मुझे उसमें से कोई भी symptoms आ रहे हैं, then it's very important that you get early diagnosis and treatment, and you follow up with your doctor, your physiotherapist very quite often. So in physiotherapy, what do we do? So Parkinson's disease में the two main issues that we address is the balance issues that come with Parkinson's, the slowness, rigidity, stiffness, and the different types of movement issues that patients come up with. So सबसे common है freezing. So freezing मतलब कि आप अचानक से रुक जाते हो. Like you know that you have to take one step ahead, but you each other, they are not cooperating with each other. So that is freezing, and we help in those cases. Fascinating यानी कि आप धीमी रफ्तार से चल रहे हो, you're walking slowly and you're taking very short steps to reach your destination. That is fascinating kind of gait. So we help with our treatment. We help to reduce these major symptoms. मोटर प्लानिंग की लाइक फॉर एग्जांपल अभी मुझे यहाँ मेरे टेबल पे पड़ा हुआ एक पानी का ग्लास है, वो मुझे उठा के पीना है पानी. But in Parkinson's, the planning is only affected. So I know that I have to pick up the glass and bring it to my mouth to drink it. But my
Dr. Khushbu, it got stuck, I think.
Because of so many tremors being present. So motor planning is affected, and that's what we help in physiotherapy. फ्रीजिंग एपिसोड जैसे मैंने एक्सप्लेन किया कि आप अचानक से रुक जाते हो. सो हाउ टू डील विथ इट? इफ यू ट्राई टू मूव आउट ऑफ द फ्रीजिंग एपिसोड एंड जबरदस्ती अगर आप आपके बॉडी को पुश करते हो, तो चांसेस हो सकते हैं कि आप आपको फॉल हो जाए, यू फॉल डाउन, or there's a chance that you might lose your confidence. So how to deal with that is immediately call for help from someone nearby. Ask them to keep a chair in front of you. Try to turn and sit on the chair, or else try to just hold on to the chair for a few seconds until you know that the freezing episode is now over and you are able to move. So don't immediately try to move when you are frozen, because you might end up in fall. So try to just hold some support nearby and just stand there for a few seconds patiently. What all helps along with physiotherapy? Lifestyle changes, counseling, social activities. So you definitely don't have to stop your socializing. You have to continue to meet your friends, be active in the community, go for social functions, go for weddings, dances, because आपका Parkinson's diagnosed हुआ है. Do a lot of mental activities. Try to do a lot of brain-related smart activities. Having a very strong support system is important. Your family is very important to give you that emotional and psychological support. And doing natural dopamine boosting activities, again, very important. So physiotherapy कैसे हेल्प करता है? It supplements the medication. So ऐसा जरूरी नहीं है कि आप सिर्फ फिजियोथेरेपी करो, medications बंद कर दो. No, medications plus physiotherapy दोनों चीजें करनी होती है. So what physiotherapy does is it causes better absorption of the drug at cellular level. So अगर आपके जो medications है, सिंडोपा या प्रामीप्लेक्स, आप वो medications ले रहे हो, तो वो जो बॉडी का अपटेक होगा वो मेडिकेशंस का, वो बेटर अब्सॉर्ब होगा व्हेन यू आर एट द सेम टाइम डूइंग फिजिकल एक्टिविटी आल्सो. Physiotherapy serves as a natural reward system, so it gives you that natural boost. अगर आज आपने कोई नया टास्क अचीव कर लिया जो कि आप इतने महीनों से स्ट्रगल कर रहे थे, तो वो आपके लिए एक नेचुरल रिवॉर्ड होता है कि ओके मैं आई वाज एबल टू डू समथिंग लाइक दिस even when after so many months I was trying. So that is a natural reward system. It keeps you independent for longer. So I know one patient जो 10 years से diagnosed है Parkinson's, but he still goes down for a walk at least for 1 hour every day. He goes for yoga 3 to 4 times in a week. He does physiotherapy. He goes to his office by train. He travels for 1 hour and he comes back home. Why? Because he's been doing physiotherapy since the day one of his diagnosis. It helps you in sustaining on the same dose for long. So as we know, Parkinson's is a progressive disease. So वो जो medicines है वो भी increase होने वाले हैं dose में. They are not going to just be at 3 or 4 doses in a day. So physiotherapy helps you to stay on the same dose for a longer amount of time instead of rapidly increasing the dose. And it helps to tackle the other physical conditions. So ऐसे तो नहीं है कि आपको और कोई physical issues नहीं होंगे. You can have arthritis, you can have tightness in your body, you can have some cardiac related conditions, you can have some breathing related issues. So it really helps to tackle these other physical health conditions also, because we see our patients as a whole person. We don't just treat their Parkinson's, we treat everything else about that person. So that's how physiotherapy helps. You can take help of assistive devices if you want. You can take the help of a walker. There are some walkers which have brakes in them. There are some canes जिसमें ये red light लगा हुआ होता है. So it really helps them to see where they are stepping and where they should be taking steps. Other things that you need to be mindful of, आपके बाथरूम में ऐसा रबर मैट लगाने के लिए, so that आप slip नहीं, because of the water you don't slip. You can keep a stand next to your bed that you can hold, and you can come up whenever you feel that you are not able to sit up in bed. You can have bars and handholds all over the house. You can just hold on. You can, like, walk everywhere in case if there is some balance related problem. आपके कमोड, बाथरूम में जो भी कमोड होगा, उसका अगर हाइट आपके लिए सुटेबल नहीं है, तो आप एक कमोड एक्सटेंशन डलवा सकते हो, जिससे आपका हाइट इंक्रीज हो एंड यू आर एबल टू स्टैंड अप मोर एफिशिएंटली. फ्यू केयर गिवर टिप्स. तो अगर आप किसी पार्किंसंस के पेशेंट के लिए केयर कर रहे हो, सबसे पहला टिप, डोंट गेट स्कैर्ड ऑफ द कंडीशन योरसेल्फ, बिकॉज ऑलरेडी दैट पर्सन इज गोइंग थ्रू दैट कंडीशन. यू डोंट गेट स्कैर्ड. और अगर उनका बैलेंस इश्यू हुआ, सपोज फॉर एग्जाम्पल टुडे दे हैड अ फॉल, बट एज सच देयर वाज नथिंग मेडिकली bad, so don't get scared. Try to reassure them. Help them to sit down if a freezing episode comes, if they are not able to balance. But don't try to coddle them. Don't try to make them more dependent. Ki, okay, you are not able to walk. Okay, just sit down. Don't walk today at all. Just sit today. Just be here. We will give you the food if you want. No, try to get them back to their daily activities as much as possible. You can modify some activities, but don't try to stop the daily activities which they used to do. And whenever required, please ask for help. And individually, अगर आपको Parkinson's है, follow your doctor's advice, stay calm, understand your own body, understand what you require. If you have to use a walking aid, please use it. Do not hesitate, but ask your physiotherapist before you invest or start using a walking aid, because maybe आपके लिए वॉकिंग केन यूज करना सुटेबल नहीं है, क्योंकि केन के भी बहुत सारे साइड इफेक्ट्स हो सकते हैं. सो आस्क योर फिजियोथेरेपिस्ट बिफोर यू यूज अ वॉकिंग एड. Indulge in different hobbies, outdoor games, and one very important factor is fatigue. So don't try to push yourself as much as you can. Take care कि आपका fatigue level ज्यादा increase नहीं होना चाहिए. What every day will look like. So ऐसा जरूरी नहीं है कि आज आपने बहुत अच्छा किया, you were physically very active today, तो कल भी वैसा ही होना चाहिए. Maybe every day as it is, and don't try to become conscious of the fact कि अरे कल तो मैं ये कर पा रहा था, आज क्यों नहीं कर पा रहा हूँ. So don't try to make it very hard on yourself. And don't forget to do breathing exercises, because that will really help you to relax. How I do is that I have consultation at my clinic, and I am available online as well. So anytime you want to approach, one video I wanted to show you of what exercises we do with our patient. So I'll just show that. So this is my colleague, Dr. Disha, demonstrating what kind of exercise we do with our patients. So I'm standing in the middle like this and touching different cones of different colors. So आपका balance exercise भी हो रहा है. Plus we are telling कि you have to touch with your left leg at the yellow cone. So that whole brain exercise is also happening with the patient. So that's how we do physiotherapy. Um, Other video I'll just show. One second. So we are doing rotation exercises in standing while keeping a challenge of putting one foot on the stepper and foot down below the stepper, so that they get a challenge of doing some balance activities. Uh,
Dr. Khushbu, we can't see the video yet.
you were able to see the previous video.
Yeah, we can see your drive actually, but not the video.
Okay, just a second. You were able to see total 2 videos, right?
Yes, yes.
Okay, okay. So that's it from my end. Yeah, so that concludes my discussion on. Hello?
Hello.
Yeah, so that concludes my discussion.
Okay, thank you. Thank you. Sorry, I missed it. There was a network
Yes.
issue from your side. So sorry. Yeah, thank you so much for this wonderful talk. It was a holistic presentation, and you've talked about everything from food habits to lifestyle to maintenance and tips and all. It was quite informative session. Thank you so much. So yeah. So we'll come to our third topic of today, which is about speech and swallow. And I don't have slides. I just have this one screen, and I'm going to talk about this. Before that, I'll introduce myself. I'm Dr. Garima, speech language pathologist, working in this profession from last 15 years, and we deal with pediatric and geriatric as well. So we had a couple of patients with Parkinson's, and yes, it's a team approach. That's when we got this idea, so doing it together. So our part as a speech therapist, starts from lungs basically. A lot of people think that speech है तो मुंह से speech therapy है तो बात कराएंगे. Yes, हम बात कराते हैं, but उससे पहले हम लोग lungs पे जाते हैं. Reason being, the adequate breath support is very important for a patient to talk. अगर उनका breath adequate नहीं है तो fatigue जो है speech में भी आता है. वो बात नहीं कर पाते, लॉन्ग सेंटेंसेस नहीं पढ़ पाते. डॉक्टर आशीष ने भी बताया कि वो छोटे छोटे सेंटेंसेस बोलते हैं. तो सबसे पहले हमें लंग्स पे जाना होता है, हमें उनका रेस्पिरेशन करेक्ट करना होता है. एक बार अगर रेस्पिरेशन करेक्ट हो जाए तो एटलीस्ट हम एक स्टेप चढ़ गए. देन द नेक्स्ट कम्स द वोकल कॉर्ड्स, द वॉइस बॉक्स जिसे हम कॉमनली बोलते हैं. उनका क्योंकि ओवरऑल वीकनेस होती है तो उनके वोकल कॉर्ड्स में भी बहुत ज्यादा वीकनेस हो जाती है, जिसकी वजह से आप देखते हैं कि उनका जो वॉइस है वो काफी लो हो जाता है. So initially we help them managing the voice initial one stage and stage 2 में. but अगर stage 3 4 5 है और जहाँ पे voice manage नहीं हो पा रहा है, then we suggest for instruments like mics and some calling bells and speech enhancement devices. So those are all aided devices which are used at later stages, but initially we try to help them with the exercises and speech therapy management. थर्ड चीज आती है आर्टिकुलेटर्स, जो आप बोलते हैं लिप्स, नो टंग, नोज का बेस, वीलम, ये सारे टीथ, ये सारे आपके आर्टिकुलेटर्स में आते हैं. सो बिकॉज उनका जैसे वीकनेस होती है, इवन इट वाज देयर इन डॉक्टर आशीष प्रेजेंटेशन दैट सलाइवा ड्रूलिंग रहता है, उनका सलाइवा गिरता है. वो इसीलिए रहता है क्योंकि उनका पूरा ओरल मस्कुलेचर जो है पूरा वीक हो जाता है. सो एज अ स्पीच थेरेपिस्ट वी हेल्प देम स्ट्रेंथन दिस एक्सरसाइजेस, strengthen these muscles with exercises so that at least वो अच्छे से बात कर सके, and as well as it helps in their food, basically chewing of food. There's a study which says कि बहुत सारे Parkinson's patient are prone to die because of pneumonia. सो निमोनिया क्यों होता है? क्योंकि उनको स्वालो प्रॉब्लम होती है. वन ऑफ द रीजन फॉर निमोनिया है स्वालो. जब उनका स्वालो इनएडिक्वेट होता है तो उनका जो भी ओरल इनटेक है, फूड है, वो सारा इसोफेगस में नहीं जाके, फूड पाइप में नहीं जाके उनकी ट्रेकिया में जाता है, जो डायरेक्ट लंग्स में चला जाता है, पानी लंग्स में चला जाता है, जिसकी वजह से उनकी निमोनिया के चांसेस हाई हो जाते हैं। तो इसीलिए एज अ स्पीच थेरेपिस्ट हम लोग स्वालो पे भी वर्क करते हैं, सो दैट एटलीस्ट उनका इनटेक जाए, न्यूट्रिशन जाए बॉडी में, एज वेल एज रिडक्शन, जो चांसेस ऑफ निमोनिया है वो रिड्यूस हो जाए। तो swallow के लिए we have different exercises which is related to their lips and as well as the neck part. So overall, if you say lips, tongue, teeth, uh, these are the all exercises for the correction of the speech. Voice के लिए vocal folds, and then respiration for the breath support to make them clear, right? And the next part is swallow, so that they avoid pneumonia, as well as intake of nutrition can be held. अब ये सारी चीजें जब आप कर रहे हैं, so we have to take care कि उनका motivation कैसा है. Lot of many times जब हम पेशेंट के साथ बात करते हैं, तो पहला क्वेश्चन वो यही पूछते हैं, स्पीच थेरेपिस्ट क्या कर लेंगे, ये तो एक्सरसाइजेज है, ये तो बस टंग का करना है या मुंह को हिलाना है, ये तो हम कर लेंगे. बट इट डजंट हैपन लाइक दैट, बिकॉज फ्रीक्वेंसी कितना होना चाहिए, कैसे कराना चाहिए, वो भी बहुत मैटर करता है. सेकेंडली, बहुत सारी एक्सरसाइजेस जो है ना, पेशेंट सोचते हैं कि हम लेटे लेटे कर लेते हैं, मुंह की एक्सरसाइजेस तो हम लेटे लेटे ही कर सकते हैं, वो that is not advisable. It is better to sit straight and then perform your exercises, because जब आप सीधा बैठ के एक्सरसाइजेस करते हैं तो लंग का जो सपोर्ट होता है वो बहुत अच्छा होता है, और उसकी वजह से एंटी ग्रेविटी जिसे बोलते हैं वो बहुत हेल्प करता है. इवन फूड के लिए भी हम सजेस्ट करते हैं कि वेन एवर यू आर फीडिंग देम, दे शुड बी इन अपराइट पोजिशन टू सिट. एंड फूड भी किस तरीके का देना है वो भी बहुत मैटर करता है, बिकॉज उनको चूइंग का प्रॉब्लम होता है, उनको स्वालो का प्रॉब्लम होता है. तो आपको फूड की कंसिस्टेंसी, कुछ लोग क्या है लेटेस्ट स्टेजेस पे मिक्सी में मिक्स करके दे देते हैं, बट अगेन यू हैव टू वर्क ऑन दिस कि वो किस टाइप का फूड चू कर सकते हैं, उनको कितना गर्म होना चाहिए, कितना ठंडा होना चाहिए, उनका सेंसिटिविटी कैसा है, उनको गर्म पसंद आ रहा है, ठंडा पसंद आ रहा है, अकॉर्डिंगली यू हैव टू डू इट. One more thing, what we really advise in people with Parkinson's is, क्योंकि उनका पूरा overall fatigue होता है, weakness होता है, muscle weakness होता है, we suggest that the strength of the oral has to be improved. Again, also sensory. Basically उनको मुंह में खाना डाला है तो उनको पता होना चाहिए कि आपने डाला क्या है, या ठंडा है या गर्म है. ओवर द पीरियड उनका वो सेंसेशन भी चला जाता है. तो उसके लिए वी एडवाइज हॉट एंड कोल्ड फर्मेंटेशन. हाउ, छोटे छोटे आइस क्यूब्स लेके उनके मुंह में रख के उनको जस्ट वी आस्क देम टू रोल इट ओवर, हल्का सा गर्म पानी डाल के, इट्स ऑल्टरनेटली हॉट एंड कोल्ड, जिससे उनका सेंसरी मूवमेंट होता है. वन मोर थिंग, ओवर द टाइम स्वालो रिफ्लेक्सेस बहुत वीक हो जाते हैं. जब वो स्वालो करते हैं फूड तो सारा खाना अंदर नहीं जाता है, इट गेट्स स्टक हियर. सो वो वी हैव टू मेक श्योर द केयर गिवर जो भी उनको खाना खिला रहे हैं कि वो वॉट एवर ही द पेशेंट इज ईटिंग इज एक्चुअली गोइंग इनसाइड, इट्स नॉट स्टक हियर एंड देयर. तो आफ्टर द फूड मेक श्योर कि आप उनको पूरा स्वालो करने के लिए बोले, ड्राई स्वालो करने के लिए बोले, डबल स्वालो करने के लिए बोले, ताकि you are sure कि उनका खाना चला गया है. And if somebody can actually look into their mouth and back part of the mouth, तो ठीक है, we are satisfied कि okay खा लिया. पानी का भी, if they have issues with water, how will you know they have issues with water? Whenever a patient is drinking water or having food, if they are coughing, that means this is a indication of silent aspiration. So to avoid silent aspiration, we again do therapy, जिसमें हम उनको पानी कम देके थोड़ा thick consistent liquids देते हैं, जिसकी वजह से aspiration के chances कम हो सके. And then again, ये सारी चीजें we don't suggest you to do it on your own without the guidance, because if you come to a speech therapist and a swallow therapist, whichever city you are in, they would be able to help you strategically कि अभी इस पे वर्क करना है, अभी इस पे वर्क करना है, और अभी इस पे वर्क करना है. अगेन ये सारा आपको जब प्लान मिलेगा, देन यू कैन वर्क ऑन इट. सबसे इंपॉर्टेंट चीज है मोटिवेशन एंड विलिंगनेस. आई हैड अ पेशेंट, वो जब मैं पहली बार गई तो वो बिल्कुल उदास थे और ही डिडंट वांट टू डू एनीथिंग. एंड आफ्टर 1 hour of the session he was so motivated. It's like मैंने तो सोचा था नहीं कुछ होगा, बट आपने तो मुझे काफी अच्छा कुछ सिखा दिया. एंड he was able to do it. जब when I started the session उनका loudness भी नहीं था, और जब हमने सेशन खत्म किया तो वो एक्चुअली he was able to talk on 30 to 40 dB. What is 30 to 40 dB? Normal conversation level is around 60 dB. Now if I'm talking, I'll be around 60 dB. सो एक स्पीच जो बनाना हम बोलते हैं, स्पीच रेंज होता है वो 60 dB होता है, तो उनका जो है अराउंड 10 dB था, हमको सुनाई भी नहीं दे रहा था। जब हम थेरेपी के बाद वो थोड़ा 30 dB तक आया, सो ही हिमसेल्फ गॉट मोटिवेटेड। सो मोटिवेशन इज वेरी इंपॉर्टेंट, कि उनको मोटिवेटेड करते रहना कि होएगा, कर पाएंगे। एंड अगेन, ये जो मैंने आपको डीबी बोला है, इसके लिए भी एज अ स्पीच थेरेपिस्ट हम मेजर करते हैं। हम आजकल वी यूज सो मच ऑफ टेक्नोलॉजी, सो ऑल द एप्स आर देयर टू मेजर द नॉइस लेवल, कि वो कितने पे बात कर रहे हैं। सो एज अ स्पीच थेरेपिस्ट वी एडवाइज यू टू डाउनलोड दैट ऐप, एंड उनका लेवल आप चेक करते रहे कि वो कितने डीबी पे है। सो एक बेसिकली क्या देता है, वो विजुअली फीडबैक दे देता है कि अच्छा मुझे ये गोल बनाना है, मैं अभी 10 डीबी पे बात कर रहा हूँ, तो मुझे 20 पे जाना है, तो 30 पे जाना है। तो वो ईजी हो जाता है मॉनिटर करने के लिए। And again, there are a lot of apps also available जो oral musculature exercises बताती हैं। Unfortunately, it is not there in Android. All are there in iPhone. तो वो देख के भी आप उनको बोल सकते हैं कि अच्छा आप ये एक्सरसाइज देखते रहिए और करते रहिए। सो एटलीस्ट होम सपोर्ट भी हेल्प करेगा। एंड ऑल्सो देयर इंटरेस्ट क्या है। अब व्हेन यू आर टॉकिंग टू अ पर्सन विद पार्किंसंस, यू नो, नॉट मेनी टाइम्स दे डोंट वांट टू टॉक बिकॉज उनको हो नहीं रहा है, और उनको बहुत फोर्सफुल लगता है बात करना। तो अगर आप उनके इंटरेस्ट जानेंगे या कुछ पुरानी मेमोरीज पे वर्क करेंगे या यादें ताजा करेंगे, तो एटलीस्ट वो, जैसे डोपामिन की बात की डॉक्टर खुशबू ने, तो वो डोपामिन रिलीज होगा, ही विल बी विलिंग टू टॉक टू यू, ही विल बी विलिंग टू बी कोऑपरेटिव। बिकॉज आई हैव सीन लॉट ऑफ पेशेंट्स विद पार्किंसन जो बस कुछ करने ही नहीं चाहते, कि आप बस बस मुझे कुछ मत बोलो, मुझे बात मत करो, मुझे अकेला छोड़ दो, ये सब चाहते हैं। तो जब आप एज अ थेरेपिस्ट, हम लोग जो एज अ थेरेपिस्ट जब जाते हैं उनके पास, और हम उनका ये सब पुरानी बातें या अच्छी मेमोरीज जब निकाल के बात करते हैं, तो हमारे को थेरेपी में भी काफी इंप्रूवमेंट दिखता है इन टर्म्स ऑफ विलिंगनेस। सो एज अ फैमिली, एज अ केयर गिवर, वी विल ऑल्सो वुड लाइक टू एनकरेज यू कि अगर वो कुछ भी कंप्लेन कर रहे हैं, आपको पता है वो कंप्लेन कर रहे हैं, आपको पता है आप कुछ कर नहीं सकते उस कंप्लेन का, बट एटलीस्ट उनको रेसिप्रोकेट करिए कि हाँ आप उनको समझ रहे हैं। तो वो एटलीस्ट उनका वो कॉन्फिडेंस लेवल आप पे रहेगा, और वो आपके साथ कोऑपरेट करेंगे, और आपको थेरेपिस्ट को बुलाने के लिए अलाउ करेंगे। अदरवाइज ऐसी चीज आ जाती है कि अगर बच्चे चाहते भी हैं थेरेपिस्ट को बुलाना करना, तो पेरेंट्स मना कर देते हैं। तो यू हैव टू बिल्ड दैट रेपो विद देम सो दैट दे कीप कोऑपरेटिंग विद यू। सो that is the only thing I wanted to tell you from my part. If you have any questions, we are open for it. If you have questions to Dr. Ashish, Dr. Khushbu, or myself, we are here to answer.
Yeah. Hi, this is Prabhat here.
Yeah, hi.
Prashant here. My dad's name is Prabhat. He's suffering
Okay.
from Parkinson's.
Okay.
But recently we discovered that it's actually not Parkinson's, but PSP. So can you talk a little bit about the difference between Parkinson's and PSPs and how they are different
Oh.
or very much correlated?
Okay. Dr. Khushbu or Dr. Ashish, would you like to take this question ahead? Hello? Mr. Prabhat, sorry, Prabhat is your dad's name, sorry. Can you please elaborate what did your doctor exactly told you?
Yes, I can answer this question.
Please go ahead.
I'll just share my PPT once again because I had covered that in one of the slides. Just a minute.
Yeah.
Yeah, I hope you can see my slide.
Yes.
Yes.
So Parkinson's is, if you are diagnosed with Parkinson's, means that it's a Parkinson's. But when there's something called as PSP, which is progressive supranuclear palsy, then it is called as a Parkinson plus syndrome. The etiology means the reason behind getting this condition is very different. The supranuclear part of the brain. So in Parkinson's, primary Parkinson's, there are different types of brain structures which are involved. But in progressive supranuclear palsy, there is a different kind of brain structure which is involved. And they say that this is much more faster in progression than primary Parkinson's. because of the aggressive nature of the PSP. And the neurodegeneration happens much more quickly than primary Parkinson's. The symptoms will be much more different than primary. There will be more of so this uh, will actually fall behind rather than going in front. So yeah, the treatment will differ a lot when it comes to PSP. Again, regardless of what the diagnosis is, the uh, the
Dr.
line
Khushbu,
of management, which is medication.
your voice is breaking actually. We missed something in between.
Yeah, now you're able to hear me.
Yes.
The progression of the disease is much more faster, but again, in spite of the difference in the diagnosis, the line of management is the same, which is medicines plus physiotherapy and speech therapy. So yeah, I hope that answers your question.
Yes, it does. So thanks for that. Irrespective of why it has, what's the etymology, the way we try to handle such patients is almost similar, right? In short.
Yes, yes.
Okay, fair. And is there any like doctor before shared in terms of the alternative uh, research that is going on to see how this disease could be cured or treated? Have we seen that stem cell therapy or something like that could help improve the conditions of the patient?
Yeah. If I can intervene in between, Dr. Ashish here.
Yeah, sure.
Please go ahead, sir.
Yeah, I think the research is on the way, but we haven't got the final answer till now. So yes, definitely the stem cell trial is going on, but nothing substantial has come out where we can say that, say for that matter, like for diabetes, the pancreas transplant is what is being planned. And a lot of places we have tried it out, it's working good, but it hasn't got the FDA approval and hasn't come out in the clinical trials authentically to be suggested to our patient at this time.
Got it. Okay. Because there are a couple of doctors who said we will try to start off with a stem cell therapy followed by the therapy that Dr. Khushbu shared. But we are not getting the confidence to even move ahead with that.
Yeah, so that's always there. Say like, and I'm not going to go into the deeper discussions of it, like the COVID vaccination and vaccination. There are a lot of 100 things which are in between. So like that also, that stem cell treatment for Parkinsonism has been considered, and that's being kind of in the thought process. Rather, we try to give stem cells as the answer for everything, but all of these things are in theory only, and we haven't yet got the substantial success as such. So that's the thing.
Thank you, doctor.
Thank you. Bye.
Thank you for that question. Do we have any other questions here from the group? Okay, Dr. Ashish, would you like to give a concluding remark?
Just one thing is 4 I's I would want everybody to remember. Information, the right information from right person is a right source is important. Investigations, please do it before it is too late. The PD or elderlies, they fall into the sickness category and reaching ICU is very, very fast. So do test before it is too late. Information, investigation, insurance. Every one of you should have 2 insurance. One is the private one from the group insurance. Finally is immunization. Everybody in this group and the PD should take the swine flu vaccine. They should take pneumococcal vaccine. You have to remember one thing, be preventive and proactive so that you don't have to be repentive and reactive. Reaching out to the dietitians, reaching out to the physiotherapists, reaching out to the multidisciplinary approach is always superior. It's in India, people like to trust doctors too much, and then they like to curse also them too much, when actually it can be shared by the other specialties like physiotherapists and dietitian and and the other counselors. So that's why my final take will be, make sure that you handle it responsibly. And last but not the least, how sick a patient is, it's all about how you hold his hands every day. That matters the most. The sense of unwanted, uncared, unloved kills more than the disease itself. Thank you. Take care. God bless.
Yeah, please
Sir,
go ahead.
is there any connection between this Parkinson's and postural hypertension? Because my husband is suffering with postural hypertension. Doctors are giving medicines, but is there any connection, or this is because of something else?
Postural, you must be meaning postural hypotension. The BP falls.
Yes,
It's not
hypo.
hypertension, it's hypotension. Yes, there is a connection. Say what happens is, as you grow old, your reflexes overall decrease. Say, we have to understand that we have to do everything slowly, and there is something called as peripheral heart. Now, calf muscle is called as peripheral heart. That works good if you're exercising well. Obviously, when there is akinesia and patient is not moving around, the blood gets pooled in the legs, and when you're walking around, the immediately BP will fall to 90-60 because of their elasticity, and the veins and the arteries have become old. So definitely postural hypertension, we see a lot of our patients, and that's why they get giddiness. So we tell them they have to wear the stockings, as well as they have to learn how to adjust and do everything in the consistent format. Last but not the least, exercise helps a lot, and it has to be started at younger age. We Indians are not, we are not that kind of population who believes in exercise. Everybody have to realize one thing: chalna hi zindagi hai, rukna hi maut teri. So everybody, right from the 6 months to 6 years to 60 years to 92 years, we have to continue walking, and that will make sure your heart, brain, kidney, lungs, everything works well. Harriet Thompson is the example I would want to set in. 92 years old lady, she had done the marathon. Now, how many of us in this group have done the marathon? At 92 years old, after struggling with 2 cancers also, she was running a marathon. So we have to give importance to mobility and physiotherapy. I hope that gives an answer.
Sir, do you recommend any kind of do you have, can you share any kind of specific focused exercises which help them better? Can you share anything when we do?
Very great question which you have asked. I sincerely think everything has to be customized to that particular patient. So we have to understand what is the physique, what is the body, and what is the background. A lot of people ask me, sir, I have a walker group in the morning, and they tell me, sir, we're missing you in our group. Why don't you come? You're a doctor, you advise exercise. I say I do not come because I know one most important thing about exercise is consistency. If you're not consistent, then every exercise is waste. You see the six-pack abs of Shah Rukh Khan, and then suddenly you are working on six-pack ab, and then you're not consistent about it. That is a problem. Whatever exercise you do it, you must do it in accordance with your doctor as well as physiotherapist, and you need to do it consistently. Majority of these heart attacks which have happened, we have seen that they have happened in the gym. The only reason was suddenly they have gone into the kind of bodybuilding focus, and raised D-dimer killed them. So you need to approach a physiotherapist or a doctor. Make sure you are physically well. Your D-dimer is good, because post-COVID or during the infection time, a lot of people, you will feel normal to exercise, but when you will not be normal. I've just treated a lady, and she had a dengue, most probably, or flu, and she says I'm 90% better, but her D-dimer was very high, 2,500. And if 2,500, she's 90% better, she starts exercising, even normal morning walk also, she will suddenly collapse like the stories which we hear it. So, you have to understand, everything has to be handled scientifically. Slow and steady wins the race. The word is steady and consistency rather than the what kind of exercise you're doing it. And definitely specific exercise have to be communicated by your trainer. We don't like to invest in physiotherapist and body trainer, which is very, very important.
Okay. Thank you, doctor. Thank you.
I'm leaving my number here, 810-612-7475, in case anybody would want to connect on WhatsApp or otherwise, because yes, it's all about giving you right information so that we can, all of us can live happy, healthy, and smile longer.
Chat box, doctor, please.
Yes, I've already put it there.
Yeah, thank you, doctor. Thank you.
Thank you, Dr. Ashish. Thank you, Dr. Khushbu, for taking out time today. We have around 14 participants, not a bad number, and we'll be recording this session and we'll be sharing it with them all. Whoever wants the recorded session to be shared, please, you can leave your details in the chat box. We will be sending it to you. Thank you so much for joining in. Shall we close the meeting?
Yes, please. Thank you.
Thank you everyone for joining.
Thanks for this informative session. Thank you for setting this up.
Thank you.
Thank you.
Screenshot this.